Surgery without knives. That's the goal at APL-UW Center for Industrial and Medical Ultrasound. Non-invasive surgery employing oiling histotripsy. High-intensity focused ultrasound heats and then liquefies targeted tissue inside the body. For example, malignant tumors.
With this method, we can produce precisely controlled mechanical lesions with sharp margins and sparing some critical structures such as blood vessels. No effect of thermal diffusion to damage intervening tissue. Ultrasound can be used for guiding and controlling the treatment.
Histotripsy can cause a wide range of bioeffects, mainly homogenization of tissue, and so that's breaking up of the tissue into very tiny almost particles so that you don't see any of the structure of the tissue.
In terms of clinical applications, the range is quite broad. It basically can be applied to anything that requires any form of ablation. Since it's non-thermal, it effectively will ablate the tissue with very precise margins. One of the problems with thermal ablation is that we can't control the heat diffusion that occurs, whereas with this type of mechanical ablation, it really is very much like a knife.
Sometimes you want proteins or enzymes to be still active and functional, but you don't want any of the cells to be intact.
So it disintegrates the cells, but the proteins are intact, and that can be significant for cancer therapies in that it could basically release cancer-specific antigens that can participate in the immune response. And that's probably one of the hottest topics in all of focused ultrasound therapy right now. My particular area of interest is in pancreatic cancer. As a gastroenterologist, we think that there is great potential for inducing an immune response. Same thing goes with liver cancers. Essentially, all solid organ malignancies have the potential to be ablated.
Ultrasound, it is real-time, portable imaging, and also the ability to use those same waves to do therapies. And it's almost too incredible, right? It's totally safe for imaging babies, yet it can do brain surgery and destroy a tumor right through the skull.
I'm trying to develop histotripsy for ablation of kidney cancer. So in other words, developing a non-invasive treatment for kidney cancer, an attempt to try to replicate what we can do with surgery, but to do so in a much less morbid and less painful way. Currently, clinically, the idea of focal therapy, or in other words, just treating the tumor and trying to spare the organ is well established as oncologically sound. But current treatments, even our minimally invasive techniques, still are invasive. They require multiple incisions and associated recovery.
The potential is there to do a whole range of things.
A wide range of clinical applications. Non-invasive surgery using not scalpels, but ultrasound.